Let's Talk Portsmouth, a new communications venue for Portsmouth residents and others interested in the historic port city. If you are concerned about Portsmouth government news and information, Let's Talk Portsmouth is the podcast for you. Let's Talk Portsmouth airs the first and third Thursday of the month. We will talk city business, including interviews with city administrators, city department and agency directors, community and business partners, and all the people who keep things in motion on a local government scene. Now, here's your host, Sharon Hoggart.
Hey out there in podcast land. This is Let's Talk Portsmouth, the podcast about the ins and outs of city government and life in the port city. Today we're going to be doing a bit of myth busting, investigating, shedding light, and asking the hard questions about COVID-19. There's so much misinformation circulating, we wanted to take the opportunity to provide you with just the facts about this global pandemic. I'm your host, Sharon Hoggart from the Department of Marketing and Communications. To help us all learn more about COVID-19, we have with us Dr. Parm Jaberi, Chief Deputy Commissioner for the Public Health Preparedness with the Virginia Department of Health, or VDH. In the essence of time, this interview will run straight through without commercial breaks so we can get some answers, learn something new, and hopefully alleviate public anxiety about COVID. Thanks for talking with us today, Dr. Jaberi. We here at Let's Talk Portsmouth are eager to talk with you about the facts of COVID-19.
Thank you so much for having me. It's a pleasure to be here with you today.
All right. So now's my time for my icebreaker. So tell us a little bit about your background, your educational, professional experience, and tell us a fun fact. I know it's a serious topic, but we want you to be loose and just comfortable with the conversation.
Sure. So I grew up in Baltimore. I went to school there, middle school, high school, and wound up majoring in biology at Johns Hopkins and going to medical school at University of Maryland. So after 26 years, I'm like, where am I going to go for the rest of my medical education? And I became very much interested in public health. I really enjoyed the study of science. I enjoyed the study of medicine. But rather than just looking at making a difference in the lives of individuals, the idea of being able to impact communities at the time was something that I really cherished. And I went to medical school towards the end of the 90s. We had just tried to go through healthcare reform with the Clinton administration. The idea there that, in order to make a real difference in our lives, we got to look at some upstream impacts, really appealed to me. So I decided to go to Tulane, which is in New Orleans, Louisiana, to study public health and to go on a path called preventive medicine. So as opposed to being a pediatrician and internist, my study after medical school was specifically focused on public health. And so what got a better place than New Orleans? And from there, unfortunately, it was during my residency when Hurricane Katrina hit.
Wow.
So I really got a chance to see how public health can play a role in emergency preparedness and response. I was in the Superdome the day before Katrina landfall, helping prepare and receiving evacuees from New Orleans and the Baton Rouge shelters in my year of residency. And so rather than just thinking about infectious disease and Ebola outbreaks and things that we used to think about back then, realize there's a role in public health and in preparedness as well. So long story short, that's how kind of my career began. I served as a local health official in the Louisiana Department of Health, came here to Virginia, worked in Central Virginia and Chesterfield, got recruited back to Louisiana to serve as a state level in 2016, and back to Virginia in 2018 as Chief Deputy Commissioner. I have the privilege of speaking with you today following the retirement of one of our health directors in the Eastern region, and then subsequently the Portsmouth Health Director in September. So I'm also the Acting Health Director for Norfolk and Portsmouth Health Departments.
That was going to be that was my first question. So you're covering both Norfolk and Portsmouth. So
yes, ma'am.
How is it going so far?
It's been very interesting and a great learning experience. I've enjoyed getting to know all the communities. I initially came to the Eastern region in April, covering both Virginia Beach and Norfolk. That was all under one director. Soon into my coverage there, and based on the lessons of the pandemic, we realized we really need to separate Norfolk and Virginia Beach under two separate health directors. So I asked Dr. Nancy Welsh, the health director from Chesapeake, to assist me in Virginia Beach. And I was overseeing Norfolk when Dr. Lauren James, prior Portsmouth Health Director, got another opportunity with the health system in the state. And I said, well, there's a lot of similarities and needs between Norfolk and Portsmouth. Let me try to see if I can also provide some assistance as we recruit for permanent health directors for both of those jurisdictions as well.
What is the strategy for the state to find, certify, and hire permanent health directors for these vacancies?
That's a great question. I think that we're definitely in some unprecedented times. There were directors that were looking to retire or separate from the agency the last couple of years. When the pandemic hit, they just, felt they needed to stay and help and assist. So finally, earlier this year, a couple of them really felt that they had other obligations, family obligations or other things that required them to separate from the agency. Mm-hmm. As always happens, some of our health directors found other opportunities with other health systems. And a couple of them just realized, with the pace of the pandemic and kind of all the demands you're hearing nationwide, that, they had some questions about their continued roles. So unfortunately, we have a good number of directors that left. Mm-hmm. On the other hand, what we decided to do is take some unprecedented actions, work with a recruitment firm to be able to hire some directors. So we have used them to hire a health director for Alexandria. We'll be announcing that later today. We have, various recruits from all over the nation coming in and interviewing for Virginia Beach, for Norfolk. And then Portsmouth is a more recent vacancy, so we'll be using the regular state websites to hopefully recruit individuals for permanent directorships. One of the things that I also did is with the new federal funding that's coming in, after we've recognized public health has been not quite funded to the level that it needed to be, is I'm beginning a training, a preceptorship program. So physicians that are in primary care fields or preventive medicine programs, there's a program at Hopkins, a program in North Carolina, that we could pay for their 2 to 3 months of an internship to come and rotate with us during the residency training, so they learn about public health. They learn about the health department of PDH. And we know that most oftentimes when you're able to get individuals in training into an organization agency, they're also very likely to then matriculate and come into a full-time position. So our strategy, in addition to recruitment, is to build pipelines for our physicians. And of course, the same goes for our public health nurses and many others. We're really being intentional at VDH to say, how can we better partner with our academic partners to be able to utilize the talent in the region and have them ultimately hired and work with the Department of Health.
Sounds like a great strategy. Now I want to get to the meat of our interview today and start this grilling. It's all about COVID-19. Now, from your research, either from your position with the state health department or personal research or whatever research, any kind of research, do we know yet where the COVID-19 virus originated?
That's a really, really good question. And this has been a topic of not only national but international interest. So, as we look at this discussion, I think the short answer is we don't know for 100%, right? Mm-hmm. We don't know exactly. There's obviously some concerns initially about whether there was a lab leak, because we know that the initial outbreaks occurred in Wuhan, China, and in that area there is a laboratory that was studying this particular virus. There's a lot of concerns. But there's also, many, many other factors that play into the transmission of such viruses amongst individuals. So right now, most scientists believe the virus, so COVID-19 is the disease, the virus that causes that, we say SARS-CoV-2, severe acute respiratory syndrome, coronavirus 2. That's what that stands for. So the virus, most scientists believe actually was transmitted from an animal to human, right? So in the meat markets there and in the very high populated areas of China where individuals, humans, are in very close contacts to other wild animals, specifically bats, the thought is that a transmission could have occurred. However, when you look at the genetic codes of the SARS-CoV-2 virus in what the last known bat that had a similar illness, the genetic codes are similar by 96%. So it's not exact. And so people that are studying this are looking at did this virus somehow change, mutate in another animal, in another species to ultimately lead to that jump to humans? Mm-hmm. Or, was it potentially something in that lab? So again, the thought is it came from animals. The thought is that transmission has occurred. That's how the Spanish influenza and many of the previous pandemic flus have occurred. If you recall, we talk about the bird flu and others. So viruses can infect other animals and jump to humans. That's normally how these pandemics begin. And we do think that's the going thought, but it looks like there's still more research and more investigations being done to really ascertain the origins of SARS-CoV-2.
Okay, now, because of your position and where you are filling in at local health departments, you're moving around the state, to different agencies and stuff. Have you observed any differences in the way Virginians have responded to COVID-19 from region to region? Are people wearing masks, cleaning properly, getting vaccinated, whatever? Have you noticed any differences?
Yeah, the two biggest, most impactful ways of preventing illness and spread is getting vaccinated and wearing a mask. And it's really unfortunate that in certain communities this has become a political conversation, because it absolutely should not be. This is a human conversation. The COVID virus impacts young and old, black and white, Hispanic, Latino. It impacts every human being at every age. And so what we're beginning to see is the behavioral factors. So those include, do I wear a mask when I'm in a congregate setting? Do I maintain my social distance? These are adopted and accepted at varying levels by different communities across the Commonwealth of Virginia. We're also seeing, different levels of uptake by vaccine. And so, again, many individuals rightfully have concerns. They have questions. Well, how are these vaccines made? Are they safe and effective? And I know we're going to talk about some of those a little later on today. And we're trying to get the information out to people and say, those who are vaccinated have a much less chance of getting the illness, and even much less chance of becoming hospitalized and dying from it, right? So all the breakthrough infections that we see, that means people who've been vaccinated get the illness, compared to those who don't get any vaccines and get ill. The breakthrough infections are mild, and it's such a small percentage. When we look at the hospital deaths that are occurring right now in Portsmouth, in Hampton Roads area, it's those people who haven't been vaccinated. So these various trends that we see, some of it is cultural, some of it is just people having some questions and concerns, and a lot of misinformation out there where we're trying to seriously combat. So, that's what it is. In terms of other things like cleaning, we were all very, very cautious when the pandemic broke out. I remember going to my grocery store, and when I would check out, somebody would come and wipe the cash register and where I put my PIN, right? We've come to realize that COVID doesn't really transmit efficiently through surface objects like that, right? So it's still a good idea to be clean, get rid of other viruses in the community, but we've pulled away a little bit of the hard surface cleaning and things like that as routinely. Again, they need to be done, but they don't need to be done after every individual, after every customer. So the main thing to know about COVID is that it's airborne spread. So if you're in a closed environment, in a home together with many other folks, in a restaurant or a bar or a building out, in the community that is not very well ventilated, and someone there has COVID, and you're not wearing your mask because you're eating or you're just socializing, well, then your risk goes up high. On the other hand, if you're in an outdoors ball game, you're at the beach, you're at the river, it's very, very unlikely for anyone, even if someone walks past you with COVID, for you to become ill in an outdoor setting, whether you're wearing a mask or not, because the chances of you inhaling one of their droplets and air particles is extremely small. So I think those are other factors that people need to take into consideration. Is we certainly lifted a lot of the restrictions from the Department of Health in terms of gatherings, but there's probably things that people can do to keep themselves a little safer by vaccinating, wearing a mask, and avoiding large crowds and indoor environments that can really help shape the spread of illness in the community.
Now, I know we're going to talk about the vaccine itself later, but I want to ask you a question. Can people who have been vaccinated, can the virus shed to other people? I've heard a lot of people say that. I've seen it on social media, and I wanted to say something, but I just let it alone because I just don't know enough. But I didn't think that was true.
I understand what you're saying. So the first part is, if you're vaccinated, and we'll talk about how the vaccine works, that just fools the body into thinking you're infected, right? Because you've got a little bit of the virus particle in there to stimulate your immune system. And the person feels like, we've seen it. A lot of individuals get vaccinated, the 6 hours or 24 hours later, they're kind of feeling, crummy is the best way to say it. They may have a low-grade fever. They've got arm pain. there's no live virus being injected into anyone. So there's no shedding that can happen.
Can you repeat
when
that?
You just get the vaccine. There isn't a live virus in the vaccine. It's particles. So there's nothing for it to shed, right? There are some live virus vaccines out there. Measles, mumps, rubella is a common one, the MMR we talk about, where there's a theoretical chance in severely immunocompromised individuals for that to happen. But there's absolutely no way when someone gets a vaccine for them to shed the virus. I think what you may be hearing is that someone gets vaccinated and they get a breakthrough infection. That means that they still get infected even though they have been vaccinated, right? So now the person's sick. Now the person has somehow still got the COVID illness, the SARS-CoV-2 virus. They have the virus running around in them because now they're sick because of the infection, not sick because of the vaccine.
Okay.
And if you're sick, whether you're vaccinated or not, you can shed the virus.
Okay.
The good news is if you're vaccinated, what we're learning is you produce less copies of it, so you shed the virus a little less. So that's the main distinction, is if you get sick, if you get ill with COVID at any point, whether you're vaccinated or not, you can shed the virus. But just by getting the vaccine, that's not a way to transmit the illness.
Now, see, that makes perfect sense. Thank you so much for let us deviate from our script here. Thank you so much for taking that question. So what segment of the state's population has been hit the hardest by COVID? Do you have those stats?
Well, I think we all have seen the impacts in every single community, as I mentioned in the beginning. I think at the very beginning, we saw that our frontline workers were the hardest hit, and in a lot of those areas, when we're talking about the grocery stores, when we're talking about our 24/7 services in hospitals, and janitorial services, and transportation, a lot of those kinds of positions were filled with, by individuals who were from the minority communities. So when we talk about segments that were impacted in the adult working population, that was initially the concern. As you probably also recall, the initial outbreaks that were very concerning and resulted in death occurred amongst those living in congregate settings in long-term care facilities, nursing homes. And so the elderly being generally immune compromised, having weaker immune systems, and living, being housed very close to other individuals were at greater risk. So those were the initial hardest hit. Then of course we saw impacts in some of our correctional facilities. Then we saw impacts at workplaces, and things have continued to change. What we're seeing in the last 2 months is as the vaccinations became available, a lot of our adult populations took advantage of that. We had pharmacy partnerships and health departments going into long-term care facilities, vaccinating all of those community members. And the disease rates and the mortality rates drastically dropped in all of those populations. So where are the infections occurring now? They're occurring amongst school-age children. They're occurring in outbreaks of athletic teams and other congregations where individuals have not been vaccinated. So the way this pandemic is changing is really we're seeing a greater impact on the kids, only because we now have a lot more protection for our adults and our elderly community because they're vaccinated.
You're listening to Let's Talk Portsmouth, the podcast, and we're talking about COVID-19 with Dr. Jabari from the Virginia Department of Health. Are we making any real headway when it comes to obtaining herd immunity in Virginia?
That's another great question. So herd immunity, just for your audience, is think about if we have a room full of individuals. Okay, we have let's say a classroom full of high school students, and in that class, 18 of them have either got the vaccine or have been ill before, so they have some protection against the illness. So now you have 2 individuals in that class of 20. Just imagine 5x4 chairs lined up that are in that classroom that are potentially susceptible to the illness. And let's just say that one of those individuals gets COVID. He's out and about and contracts it, comes to the class and doesn't know he has COVID. So the chances that that individual sits right next to the one person who hasn't been vaccinated or has no protection is low, right? So he's more likely to sit next to one of the 18 people that is protected rather than the one who's not. And so he may come into the class, but because those people around him are vaccinated, have protection, he's not going to spread that illness. Now let's take the other option. Let's imagine no one in that class has been vaccinated, let's imagine that, a couple people may have gotten ill, but rather than 18 people being protected, only 3 or 4 are protected. So that means like there's 16, 17 people who remain susceptible to the illness. Now, when that one person walks into the class, he's very likely to sit next to someone who hasn't been protected. Therefore, they get ill, and then they go ahead and transmit it to their family, and it propagates, right?
Mm-hmm.
So herd immunity means you have enough people in the community that have either been vaccinated, have developed the infection, and if they come into contact with someone who's ill, they're not going to get sick and keep propagating the disease, right?
Mm-hmm.
So the question is, what is that right answer? And in our example, is it 18 out of 20? Is it 16 out of 20? Is it 10 out of 20? And so the general numbers we had heard from Dr. Fauci early on is 75%. So 15 out of 20 should be protected. Then when the Delta variant came, that virus unfortunately spread a lot more easily to a lot more people. So people said, rather than 15 out of 20, maybe the real answer is 18 out of 20, right? So go from 75% to 90. The herd immunity concept, it's a concept, but in practicality, it's really hard to pinpoint. The whole idea is how many people does it take for us to be able to not have a spread of illness occur. So bottom line, the more people get vaccinated and the more time that passes, the more individuals will either, again, get that immunity as a result of vaccines, as a result of being sick, the less likely it is that they will become sick again or be able to pass on the illness. Our whole focus in the Department of Health was to build immunity through people getting vaccinations,
Mm-hmm.
not through people getting sick. So we want to encourage vaccinations so we have as many people as protected as possible and limit the spread of illness.
So right now, high schoolers and I guess some middle schoolers, if they're a certain age, they can be vaccinated or have been vaccinated. So what are we going to do about the elementary school children from that, 5 to 11, that age
Yes.
group? What's going to happen? Are they
Yes.
going to be able to get vaccinated anytime soon?
Yeah, so that's on the verge of approval. We're just a couple weeks away. So the data has come in that from the Pfizer vaccine, at least, they have a slightly different formulation than the vaccines for 12 and up.
Mm-hmm.
But we're just on the verge of that vaccination. So as soon as that is approved, we'll be distributing the vaccinations to the pediatrician offices. As you may know, we've had a very large vaccination site start at the Military Circle Mall,
Mm-hmm.
and is there Tuesdays through Saturdays from 10 to 7:30. We offer booster doses, first doses, second doses, and we will also have the pediatric doses, right? So for parents that may not have a doctor to go to right away, or they're new to the area, or for whatever reason, we're going to have that site for anyone that is interested in getting their children vaccinated to come. So we just have to wait for that approval. We're still a few weeks away for the younger kids.
Mm-hmm.
You touched on a good point. The 12 and up is approved right now, but unfortunately, we're still under 50% of our kids in that age group being vaccinated. So it's really important for our parents, for our guardians out there, to bring their teens and their young adults to ensure they get vaccinated. So going back to the concept of herd immunity, making sure people aren't getting sick, there's still many folks in the area in Portsmouth, Norfolk, and abroad that can get the vaccine that have not yet. And so we want to make sure we take care of those individuals while we're still waiting for the 5 to 11-year-old vaccines to be fully approved.
Okay. Let's talk about the vaccine. Again, there's a lot of misinformation out there about how quickly it's perceived that it was quickly developed, how quickly the COVID-19 vaccines were developed. Can you explain how the vaccines were manufactured and what technology is involved?
Sure. This can get pretty technical, and I may not even be the total expert on all of this, but I think, there's a lot of misconceptions about how quickly things were developed. So let me just start with that piece first. So, look, we're vaccinating against all sorts of illnesses out there, right? We talked about MMR, hepatitis B, tetanus, whooping cough. The idea of how vaccines work, which is in principle, you fool the body into thinking it's infected by injecting a dead piece of the virus or a protein, a part of a virus inside of the body, to fool the body into thinking it's been infected, so it mounts an immune response. It kind of creates an army of cells ready to fight that infection. And they stand up, they start fighting it, and then the body's like, wait, that's not the real infection. But by standing up those army of cells, when an individual actually gets the virus, gets that infection, that army of cells is already made, ready to go, and they jump on it, and therefore the illness doesn't really take hold. If you're not vaccinated, your body gets the real virus. It will mount that same response of those army of cells, but guess what? Since it's the real virus and not a dead particle or vaccine, the virus is causing havoc. You're getting inflammation, you're getting fever. With COVID, you're getting the cough. It's impacting your lungs. So while your body is taking the time to build that army of immune cells, right, to fight the infection, the virus is also beating your body up and causing you to be severely sick. So what happens is, for most people overall, is that they get ill and the body builds up enough of an immune system that it eventually gets rid of the illness. So many folks recover at home. Many folks may have a little shortness of breath, chest pain, but they do okay.
Mm-hmm.
But in some individuals, as we know, that doesn't happen. If you're elderly, if you have underlying conditions, obesity, diabetes, hypertension, all of those kinds of risk factors, it can really work against you. And as your body's trying to mount that immune response, the virus takes lead, gets you really sick, you wind up in the hospital, and you're not able to necessarily recover from the infection, right?
Mm-hmm.
So the whole point is the vaccine, what it does is it tricks the body into thinking you've been infected, gets that immune cells up. So when you get the real virus, you're 3 or 4 days into it. You're not letting the virus take hold of your body and get you sick, affect your heart, affect your lungs, affect your breathing until the immune system is built up. So that's how vaccines work.
Mm-hmm.
as a whole.
Mm-hmm.
What happened with these two viruses? We threw around these fancy terms like the mRNA vaccine and
Yep.
so forth.
Yep.
RNA is simply, we have RNA and DNA. That's a genetic code. For people that do computer coding or others, the way our cells work is that they follow a genetic blueprint, right?
Mm-hmm.
So when we're in the womb, when we're in developing, it's that genetic code that allows those cells to develop from 2 to 4 to 8 to 16 to 32 and go on and on and on to millions and ultimately form a human being, right? It all starts from one sperm and one egg where that genetic code is there. So we have this blueprint of how we're all formed, and so do viruses. And so what the scientists had done in this particular case is they looked at the blueprint of the COVID virus. They took a very small piece of it that codes for what's called the spike protein. I think a lot of people have seen the 3D image of the coronavirus, when CNN or other news networks show it. It's like the sphere, and then it's got these red spikes on it. They call that the spike protein. In the real world, that spike protein helps the virus infect our cells. And so scientists took the genetic code of just that piece of the virus. They studied it, and they said, if we put this in a solution that we create a vaccine, we inject it into individuals, the body just sees that little bit of the coronavirus, and it mounts an immune response that's going to help it when they actually get exposed to the whole virus, okay?
Mm-hmm.
So the mRNA is simply a small genetic blueprint of just that little piece of the virus. It can't replicate the virus inside of you. It's just a code. It's not even a living organism. And so scientists use the technology that we have been using for many, many years against many other vaccines. We use a dead virus with the Johnson & Johnson, in this case the mRNA, to just simply fool the body into thinking it has been exposed to the coronavirus by just exposing to actually a small piece of it, and making the body feel and get fooled into actually being sick, mount the response, and so when the individual actually comes into contact with the real virus, they have that army of cells. So it's a little hard to visualize all that, and I know I'm speaking a little fast, but that's really the bottom line. That the reason these things were developed quickly is there was an international emergency. People were dying at high rates, and the actual design and experimentation followed on many other years of research previous to that with other vaccines. So I don't think people should be worried about how quickly it was produced, because the science was there beforehand.
Mm-hmm.
And what I would say to kind of comfort everyone is we've got this into millions and millions of arms, not only across the U.S. but across the globe. And to kind of give people some reassurance of the safety, I'll talk about what happened in the spring. Some people may remember the Johnson & Johnson vaccine, for example, was put on hold for just a brief few weeks. when there was some concerns about it causing a blood clotting syndrome, right?
Mm-hmm.
So how did that come about? Listen, every time something bad happens to somebody as a result of the vaccine, doctors or healthcare professionals, they're entering that information in a database that the CDC controls. It's called the VAERS database. So let's say one thing happens in Norfolk, one thing happens in DC, one thing happens in North Carolina, one thing happens in Michigan. The doctor's like, okay, that's just one case. But when we look at it nationwide, we say, oh, there seems to be a pattern here. And in that particular case, with a few hundred and close to 1,000 of these cases, someone said, hey, there could be something really bad happening here, and we're not picking it up. So we looked at it, we studied it, and after a full evaluation of looking at all of the cases of individuals who received the J&J vaccine were protected against it versus the few individuals who got some more serious complications, they said, you know what, it's still a good thing to do. So the example there is when there is a side effect from a vaccine, we're looking at it on a global scale and then on a national scale. We're transparent to our residents. The FDA and the CDC have that obligation to tell us if the vaccines aren't safe. And so far, the overwhelming evidence says it's much better for individuals to get the vaccine, prevent the illness, rather than worry about the potential side effects, which can happen, but is extremely rare.
Well, you've answered my next question, and that's the best explanation I've heard about how this vaccine was developed. And I think that our listeners will really get some good information out of that. I appreciate that. But I still want you to repeat it one more time. Are the vaccines effective? Are they safe?
Yes. Bottom line is yes. The vaccines are safe and effective. All of what I just mentioned and the role of the FDA, the CDC, and what we got to do with the health department. Every time we get a report, if someone's become sick or has a concern, we have to report that up. And our data show that they are safe. So that means that they're not causing individuals to die from it. They're not causing individuals to have very serious complications as a whole. Again, when you do something to people millions of times over, there's going to be several hundred or a very, very small portion across large populations that may have that illness. I remember giving this analogy a little earlier. Some people hear about anaphylaxis, right? It's a severe allergic reaction as a result of a medication or a vaccine that someone could die from, right? So that happens on a couple cases over 1 million, potentially. And if it happens, we can inject epinephrine. There's ways to reverse that to prevent that from happening. So when you take all of the population across Hampton Roads of over 1 million, that means somebody could potentially get vaccinated and have a really, really bad outcome, putting them in the hospital or even potentially dying. One person. Let's look at how many deaths COVID has caused across the eastern region. How many thousands have died from that already, right? So we've got 13,000 deaths across Virginia. About let's say a fourth or a fifth, I don't have that exact number for the region, is attributed to us. So we're talking about, you take the vaccine, your chances of is at 1, versus if you don't take the vaccine, your chances of dying is at 2,000. So really, when we say it's safe and effective, it's because the chances of you becoming severely ill from this vaccine is just so low. We say it's worth taking the vaccine. The effective part has to do with, okay, if I get the vaccine, do I still get sick from it? And there's some variation there between the vaccinations. So when the Pfizer and the Moderna vaccine, the mRNA came out, they were protective upwards of 90%. That means that if 100 people got infected with the virus and they all had the vaccine, we may see 3 or 4 or 5 individuals potentially come down with the illness. For the J&J, it was only effective closer to 72%. So if 100 people got the vaccine, you may see 28 or 29 of those individuals still get sick. So the mRNA vaccines are slightly more effective. However, the important part of this was that we wanted people from not just getting sick, is not dying from the illness. And all 3 of the vaccines are extremely effective in preventing severe disease and leading to death. So when it comes to effective in terms of, again, preventing severe complications, all 3 are extremely good. On the initial cases, the Moderna and the Pfizer may have had a slightly better profile. The news of this week, as you may know, is just last night, the FDA approved booster doses. We've already had them approved for the Pfizer vaccine, but also now for Moderna and J&J. So they're looking at, if you got the J&J and you needed a follow-up dose, you can now get the Moderna or Pfizer. Or if you got the Moderna and Pfizer, you could theoretically get the J&J. So this is brand new breaking news information. So we'll exactly see how this rolls out. But the bottom line there is with boosters, the idea is when you get a vaccine over time, those cells I told you about, that you start losing them in your body, the immunity that you built up gets lower and lower over time. So another shot in the arm a few months down the line can help you really boost that immunity back up, right? So you're asking about the safety and effectiveness of the vaccines. The effectiveness is based on the initial series, either the 1 dose of the J&J or the 2 dose of the Moderna and Pfizer. Clearly, for all of them, when individuals get a booster, that effectiveness goes up. When you get another dose, your immunity goes up even higher. So I think that's really promising, again, for those who are 65 and above, have underlying medical conditions, that they can now get a booster dose regardless of what vaccine they got previously.
Okay. I want to shift gears with you a little bit because I think the way the rollout of the vaccine went and the way it was communicated to people, that set off this chain of all these theories and conspiracy theories and inaccurate information. So in general, how do public health officials go about collecting and disseminating accurate information about any kind of public health crisis? What's that process like?
It all depends on the community. Every community is a little bit different, right? So when we're talking about, some of the largest, most effective is, people in the community have seen me on TV, on radio, providing mass communications. But certainly one way of making sure individuals are getting good information, it's not misinformation, it's not hearsay, is to go to credible sites like the Virginia Department of Health, the CDC, and we have that information posted, and we often have it in different languages as well. So people can consume that information and think about it. One of the other things I've seen that's been really effective in Portsmouth and in Norfolk is what I call communications through trusted partners. These are faith-based leaders. These are doctors who practice in the community and have direct relationships with community members. We sometimes find it useful to have them be our messenger. We share the key points, the key topics around vaccinations, around boosters, and we share with them so that they could carry on the message into the community. Again, we just have to be careful that the sources of the information, if it's not a government employee or a state person, which is exactly what we want, is we want the information to be disseminated from multiple channels, that is correct information, that is up-to-date information, so our community members are getting the best possible advice at any one time. Again, I would say because things change so quickly, even our public health staff are learning. We weren't expecting this switch around booster doses with Johnson & Johnson, Moderna, Pfizer. We're all learning it together. So the best thing to do is go to the website, because those are the most easily updated and changed for individuals to have the most accurate information. Again, Department of Health, CDC. You really want to be careful if you're searching on the internet and you go across other sites, because you just can't verify the quality of the information.
Indeed. So what lessons have you guys at the Virginia Department of Health, what lessons have you learned about communicating information in a public health crisis such as the COVID-19 pandemic?
I think the lessons of any time we're faced with an emergency is first, you got to get the information out there quickly so people know what to do. You have to be right and credible. And I think the hard part of the pandemic is this was a new threat to all of us. So even our best scientists in the CDC at the national level and the state level, there was just a lot of unknowns. So when we first started out saying, well, we don't need masks, that should just be for the sick people, that was partly because of supply and logistics. But as soon as we found out the data shows that masks, in fact, help reduce the spread of illness, we changed course nationally and at the state, right?
Yeah.
So the thing is, we're learning, we're getting new data, and as that data comes in front of us, we change our recommendations. It challenges our prior concepts. I'll give you one real clear example. Before the pandemic, in the fall season, we used to tell people, if you get the flu, stay home. Don't go to work. Don't send your child to school. But people say, I'm a tough person. I'm going to fight this out. Nothing's going to keep me back, right? But now if somebody shows up, runny nose, cough, they're not going to be in the school or workplace very long. People are going to give them a funny eye. They're going to want that person home because they don't want to contract the illness, right? So we see a culture change. We see more focus and more attention on how we can all protect ourselves, how we can all protect our community, our loved ones. And the key thing with this pandemic is that individual decisions, we want to respect everyone's autonomy in the decisions they make. But when you talk about infectious disease, individual decisions impact the community. So if I decide I don't want to get vaccinated, I'm an adult with sound mind and body, I don't want to get vaccinated. But one day I'm in the community, at the workplace, I get sick, and I inadvertently give it to my pregnant wife. I inadvertently give it to my mom who is in her 80s and has hypertension and diabetes, and they get ill and they wind up in the hospital, and God forbid they die. My decision to protect myself from the vaccine actually resulted in me getting the virus and passing on to others. And so I think that's the hardest part public health has been grappling, is how do we inform the community? How do we let them know that individual decisions can impact not only your health, but those around you, and to really have some good conversations around those kinds of tough issues.
Is it possible that we can eliminate the COVID-19 virus, or will we have to be vaccinated annually like we do for influenza?
Yeah, I think unfortunately this is beyond the point of elimination. It's exactly that. So a pandemic is when you have a new virus and it takes over the globe, right? It's all over. We use the word epidemic, when we have an outbreak in a certain area, a certain community, an outbreak. A pandemic is global. So this virus has made its way all over the world. And, unfortunately, there's just no way that we can eradicate it. So it is exactly what you mentioned. It is likely going to be a virus that keeps changing just a little bit every time, kind of like the flu does. Why we have to get flu shots every year is because the flu virus changes itself a little bit, and we gotta get the most up-to-date vaccine. The coronavirus is going to do the same, and so that's the theory behind these variants. We obviously saw one of those, the Delta variant, that came out of Southeast Asia, and it kind of took over the globe with that new variant. So it's already changing. It's already, different strains are already developing, and we have to keep a close eye on those new and developing strains. So my guess is, we're seeing cases go down across the Commonwealth, which is wonderful. The question's going to be usually these cold viruses, these coronaviruses, ramp back up again when we have a little colder climate. So around the holidays and into January, February, is that going to go up? Are we going to potentially see another variant from another country or here in the U.S. take hold? We just don't exactly have enough information to be able to predict, but we do know, unfortunately, that it's here to stay. We are going to see other variants, and really the best thing people can do against the current virus or future ones is to get vaccinated.
So we've lived with the COVID-19 virus for nearly 2 years. Where do we go from here? Is it our new reality, living with a deadly virus and just being prepared as best we can?
We've learned so much. It's been 2 years, but now we know that we can test if we have symptoms. We know now that masking works. And again, what I've mentioned over and over is now we have vaccines that can prevent the illness and death in our community. So, we're going to have to live with this, as just mentioned, kind of like the flu and many other transmissible viruses. There's many other cold viruses out there that can cause complications in young children or, again, in the elderly. And so, we all just have to simply be aware. We all have to simply take the actions we know work against any sort of an infectious disease, to stay home if you're sick, to try to isolate yourself and prevent the spread, to get vaccinated, to do hand hygiene. All of those basic things we've talked about the flu would be very helpful against this virus. And certainly as new information evolves, as we learn more about the progression of this illness, stay tuned to the Department of Health, your local health department. One other huge source I'd mention in terms of trusted resources are community doctors and hospitals. People from the community have to rely on their healthcare providers to provide them the best advice. And we want to make sure that, as this situation evolves, our residents in Portsmouth and in Hampton Roads are in fact receiving that information. So, it is a new reality that we have to deal with, but looking at how far we've come just in the last 18 months with our new opportunities to fight off this illness, I'm feeling very optimistic that we've developed a lot of capability, both at the local and state level, to protect our public. And I think as a whole, as a nation, we've become much more attuned to how we can prevent infectious diseases from spreading in the community.
Now, this is, I want you to put your looking glass on there. What is your crystal ball? What is the likelihood that a virus of this magnitude will strike again? And if it does, how are we going to be prepared for it?
Oh, that's a really foggy crystal ball. So I'll mention a little bit of my education at Tulane. It happens that my master's thesis was on pandemics, just so happens, and I studied the 1918. So we know that the last century there were two other flu pandemics occurring in the 50s, a small one in the 60s. A lot of folks probably remember the H1N1, right? Mm-hmm. That was the 2009 flu virus that impacted kids. So we know that these kinds of things happen about once every generation. The severity of this certainly outdoes any of the other pandemics we had seen, even the really bad one in 1918. So, unfortunately, it's just the nature of the beast that we know that viruses that are in animals, whether bats or birds or other species, that they could potentially jump into a human in close contact, and that human winds up spreading the illness to others, right? Yeah. So the what I can share with you is more than likely we will see another pandemic in our lifetimes. The question is, will it be as severe and as pervasive as we've seen with this one? And that I just can't tell you right now.
Does the health department use some kind of method or model that you can predict? When another super virus might strike, you have some kind of model that you use to predict that kind of thing?
Sure, yeah. So that kind of thing usually goes beyond the local and state health departments. That's again where the CDC comes in, where you look at a virus that has impacted a specific individual. When an individual gets sick, we have different sorts of laboratory testing that we could look at the genetic code. And so if a number of individuals, at least in this case in Wuhan, China, suddenly got sick, and it didn't look like any other illnesses, people started getting suspicious, and they knew that they had the emergence of a new infectious disease. So, it goes beyond the local and state, but certainly at our state level, we have the Department of Consolidated Laboratory Services, that's our state public health lab, that is able to, when people get ill, whether it's the flu or other infectious diseases, they look at the genetic code and they're able to tell whether we have variants or whether we have some new potential strain of concern. So the idea is, first of all, we got to do surveillance. Then if we see certainly that case developing, we alert our CDC, our national partners, to see if other parts of the nation may be facing the same thing. And, of course, from there, we then go ahead and sound the alarms when new strains arise.
Dr. Jabari, I am just so thrilled. This has been a great conversation, great information. We hope that you'll come back to Let's Talk Portsmouth next year with any COVID-19 updates. You want to have one last word as we wrap up?
I just want to thank you for this time. I want our community to know that we can fight this together. I appreciate everyone making the sacrifices as individuals and as groups to get us through this pandemic, and we will beat this pandemic. We will get through this, and we all look forward to better times ahead in 2022.
Thank you so much. Appreciate it. Thank you for listening to this issue of Let's Talk Portsmouth. You can find our new show wherever you listen to podcasts, including Podbean.com, Spotify, Amazon Music Audible, and ListenNotes.com. Let's Talk Portsmouth posts every first and third Thursday of the month. Upcoming episodes include a discussion about American literacy, keeping fit and fabulous, mental health, and the holidays. Hope you'll join us. We're out of here.
Thanks for listening to Let's Talk Portsmouth, the podcast that's all about the city of Portsmouth. Check out our next episode for more news you can use and information that may just change your perspective. Find our podcast on Apple and Google Podcasts, the Podbean app, Spotify, and iHeartRadio. Until next time, take care.